So let me start by thanking everybody for coming to the second annual Lohman Family Diabetes and Wellness Conference. It has really, truly been a pleasure today. I have interacted with so many people today that have made the effort to come, that came 2 years ago and came again. I've met so many new people. It was a pleasure to see some of the patients that I see in the clinic come join today. And I just want to emphasize the reason why we have this conference is to bring together our local community that deals with diabetes. When we try and handle diabetes by ourselves in a bubble, we are denying ourselves the opportunity to learn and grow from each other. But when we come together and we share our ideas about what does work and what doesn't work, it creates this synergy and we're all able to benefit from it. So keeping this in mind, our last lecture of the day today is devoted to the people who support those who live with diabetes. One of the routine questions that we'll ask as endocrinologists at the first visit is, who do you live with? Because that will make a difference in what goals we set for the patient. If we know that somebody is living alone, we will intentionally set the goals a little higher to avoid severe hypoglycemia, in which case, if somebody is living alone, there's nobody there to help rescue them from that situation. Also, if we know somebody's living alone, we often will bring them into the clinic more often so that we can reinforce concepts, so we can provide some moral support, and sometimes we can just cheerlead them and maybe give a hug once in a while. So having a supportive patient partner makes a tremendous difference. I cannot emphasize that point enough. As endocrinologists, we are deeply grateful to those who are willing to work alongside people who have diabetes and do the daily work it takes to make life worth living. So let's start with the state of where we are with diabetes right now. So this was an article that was just published last month in the New England Journal of Medicine. It was a perspective article by a University of Chicago professor, whose name is Dr. Marshall Chin, titled Uncomfortable Truths, What COVID-19 has Revealed About Chronic Disease Care in America. Diabetes, along with other diseases, is a chronic care disease, meaning that it requires medical management over a lifetime. And as many of you are aware, during this pandemic, so many of us diverted our efforts towards what we normally do so that we could shift and focus more on what was happening with COVID-19. And I myself found that that was true. In the office, I devoted a lot of time per patient visit to making sure that patients were safe, talking about how to protect themselves, what to do if they were diagnosed. And as a result, we had many less in-person visits for diabetes. We had many less prescriptions overall for metformin and statins and other things that we normally would give patients with diabetes. And we had a lot less testing done at the labs for hemoglobin A1C, lipid panels during the pandemic. But now we're starting to come back and we're starting to see where are we now, how are we doing with diabetes. And what we're finding is we're doing a great job with bringing new medications to market, and the technology is amazing, and we're spending a lot per patient. But what's a little disappointing is that we're not really doing that much better in terms of outcomes. If it was a matter of how much money we put into it, we should be at the top of the world when it comes to our outcomes. But the reality is that our mortality rate, literally the death rate from diabetes, is higher in the US compared to comparable countries. And comparable countries are places like the UK, Canada, Australia. So why is that? Well, no Lohman Diabetes Conference would be complete without at least one football analogy. And I haven't seen one today, so I'm really glad I did put this slide together. As many of you probably know, Lowell graduated from Florida State University, Nancy from Ohio State. I'm a University of Miami graduate, and last night was particularly painful. Congratulations, Lowell, on the FSU win yesterday. And we are fans of the University of Florida for what they have done for our area and to bring more diabetes care here. This particular picture is from the 2002 National Championship game between the University of Miami and Ohio State, which was probably glorious for Nancy and devastating for me. And for those of you who know football, it's where I really, Julie, congratulations on the FSU. I'm sorry, I didn't acknowledge that earlier. But for those of you who might have watched this game in 2002, it was a tremendous opportunity for me to really learn what a pass interference call is all about. So the reason why this slide is up here is because there's an NFL coach named Bill Parcells who said, "You are what your record says you are." Unfortunately, what our record is telling us when it comes to US healthcare is that something is not adequate in our healthcare performance in the US. Our outcomes reflect what our system rewards. And in our current healthcare system, financial rewards go to surgeries, procedures, medications, devices, and the entities that bring those to the market. And that's okay, we should reward those people. But what our healthcare system undervalues is human relationships, connections, and in my opinion, undervalues the impact of longitudinal primary care. And what I mean by that is if somebody requires a 4-vessel cardiac bypass surgery, we will pay more for the 4-vessel CABG surgery than we will pay for 30 visits with a primary care physician that might have prevented the need for that surgery in the first place. So something needs to change because what we should reward is what we value. And what we value is the excellent health of all patients with diabetes. So the truth of diabetes care is that while technology and new medications are absolutely essential to improving outcomes, the real difference in who has excellent control and who does not comes down to the battle that is fought in the trenches, which is the daily monitoring of blood sugars, intentionally participating in daily exercise, making good food choices, modifying behavior to improve blood sugars, and mitigating social needs, which means getting patients to appointments, making medication affordable, getting patients to get their labs done. So we know diabetes is a serious disease. Billy Wheeler did a really good job pointing out that it is the 7th leading cause of death for the World Health Organization. Its prevalence is increasing in low and middle income countries, and it's the cause of all these terrible things that we don't ever want to happen to any of you. And we know that that's preventable if we're able to take good control of diabetes early on. So back to football for just a minute. We know that in football, a lot of times the glory goes to the quarterback or to the receivers who make the touchdowns. But to win games, you have to have a strong offensive line and you have to have an excellent defense. So good football organizations will invest in the whole team. Same with diabetes, we need a team of people, and we're going to go into detail about what that team involves, but notice at the center of it all is the patient partner. And with that, I will turn the microphone over to Nancy.
Thank you. Thank you, Sheila. So you've already sort of picked up on this today that she is the science and I am the support. Let me put it another way, she is the intellect and I am the entertainer. So Sheila, I'll just nod at you and you can change the slide if you would, please. Thank you. Thank you. Okay, so I want to talk a little bit about how Lowell and I manage as a team his diabetes. And sometimes he'll say to me, do you think you're a diabetic too? Do you feel like you're also a diabetic? And truly, many times I do. There's a reason why I have Lowell's Gold Lame purse in my hand, which I will get to in a moment. But you can see it is a team effort, right? And this picture really says it all. You were not in the canoe that day with us. And by the way, sidebar, Sheila, we were at that Miami, Ohio State game. I called my niece and to see 80,000 people, most of whom were wearing red. And I said, Ashley, it's Aunt Nancy. We're above the second O in Tostito. We're in red. Now 80,000 people were in red. And she said, oh, Aunt Nancy, I think I see you. So in this canoe, here we are at Chateau Les Louise in Canada. And we're in the canoe. And you might think that Lowell and I have this perfect, harmonious life all the time. And I'm going to talk about how I support him and how amazing of a husband he is, and he truly is. And I try to be the best wife I possibly can. But sometimes you find yourself in our canoe. Now we are canoeing, and he is telling me I'm canoeing incorrectly. Now, we're in a lake. I said, it doesn't matter. We can't go anywhere. He said, you're not canoeing correctly. And I said, it's a lake. It doesn't matter. So you can see that we were not quite on the same page that day, right? But one of the things that I like to share with all of you is that my vested interest in making sure that Lowell is the healthiest diabetic he could possibly be is because the end result isn't just that we have better diabetic management, that we prevent a lot of chronic and difficult diseases and symptoms and ailments from Lowell's type 1 diabetes, but we also have a lot more freedom. Next week at this time, we'll be in London, England. And you know, the first thing that I'm thinking is, please, Lord, let us test negative on the PCR test, right? That's the first thing, right? So we don't have to cancel that, right? Please, Sharon, I'm counting on you, girlfriend, okay? And Jody knows that too. But the reality is, we have to be very prepared in order to have the freedom, right, to travel. We have to be very prepared to have that minimal stress in our lives. And so that's what a good partner, I think, can do in the diabetic relationship, is provide a better life for both of you. More freedom to enjoy life, less stress, more enjoyment, and just in every possible way that you can become, that you can have a better life. You can do that if you manage diabetes together. And so, next slide, please.
Okay, back to me. So, while we're commenting on how important the patient partner is, just to note that loneliness is rising in the United States. We're starting to consider it somewhat of an epidemic. And what the graph on the left shows is that this is patients' reported symptoms of loneliness have increased from 2018 to 2020, which certainly is a reflection of COVID. And what the graph on the right shows is that, now this graph can be a little confusing because on this graph, the higher up you are, the better, because the y-axis reads proportion of cases free of diabetes. So patients with higher loneliness scores were less free of diabetes, meaning we saw more incidence of diabetes, and patients who had lower loneliness scores had less incidence of diabetes. So one thing to note about loneliness is when we've done functional MRI studies, if you cause somebody physical pain, a certain area of the brain will light up. And when we socially isolate people and keep them away from people that they love and social interaction, the same section of the brain lights up, which means that our brains process loneliness just like our brains process physical trauma, meaning that it hurts. We have evolved as a species to be social. We benefit from social interaction. We enjoy being with each other. We feel better when we contribute to our community, when we forge lasting bonds with each other, when we help each other out, and when we share experiences. And in the words of our current Surgeon General, Dr. Vivek Murthy, we are simply better together. So being a patient partner, like Nancy, like Frank, certainly helps benefit the patient, but it totally benefits the partner too. If we all live the way patients with diabetes are supposed to live, it would be a much healthier population, and helping others makes us feel good about ourselves. Still sorry.
Yes, go ahead.
So let's get practical here for just a second. Nancy put together this lovely slide that talks about what we do at every visit when you come to the endocrinologist. We'll always look at your A1C. The goal in general is to be less than 7%. We'll always look at your blood pressure. The goal is to be less than 130 over 80. And we'll always look at the cholesterol, specifically the LDL, with the goal to be less than 100 if you have diabetes, less than 70 if you've had a heart attack or stroke, and sometimes we'll aim to just get it as low as we can possibly go. We want everybody to quit smoking, and we'll always monitor for the microvascular complications, which can include eye disease, kidney disease, renal issues, and then we pay some attention to your dentition as well.
Okay, so thank you. One of the things that I realized, and it wasn't years and years ago, it's been fairly recent, is that it is very beneficial for Lowell in managing his diabetes when I go to see Sheila with Lowell. So when I go to Dr. Gupta with Lowell for his appointments, I learn just as much as Lowell does. I'm reminded about good practices just like Lowell is. And so the very first thing that I emphasize in terms of support, if you're that supportive person with someone in your world that's a diabetic, is to make sure that you both together have a relationship with all of your healthcare professionals. That has been so important, and there's so many reasons why. But I noticed when I first went with Lowell to his cardiologist, now his previous cardiologist had retired, so we went to a new cardiologist, and Lowell had already discovered that this man had graduated from the University of Michigan. He already knew and was prepared to make a joke about the fact that his wife graduated from Ohio State, and that we had this rivalry going on in this cardiologist's office there in Daytona Beach. He did that on purpose because I knew Lowell wanted to make sure we got to another level with this doctor, right? He wanted to create a friendship and a relationship. So if we call Dr. Wilson, he's not like, oh, what patient is that? Oh, that's Lowell. And we talk about football every single time we're in the office. Or, oh, that's Lowell, who was amazed that I graduated with a degree in organic chemistry. I mean, I'm pretty amazed at that. Who gets a degree in organic chem, right? But this cardiologist did. And so we talk about that every single time we go into his office. Why? Because we want to make sure they know us and we know them. So there's this relationship. Some of the other people that we have worked hard at making sure we have positive relationships with is our pharmacist, our podiatrist, our ophthalmologist, who was here earlier today. Anybody see Dr. Don here? Right? Our optometrist, and our dentist and our periodontist. Now, why is that beneficial? Because guess what? When your tooth starts to ache, it's usually on a Friday afternoon of a holiday weekend, right? Isn't that usually when things happen, right? It's when you think that you have that sensor, that transmitter, that you only change every 90 days, you think you have that extra one and you don't you need a cell number, right? Don't you need a doctor's cell number at that moment in time, right? Is so you can text or call. And of course, in this beautiful community that we live in of Daytona Beach, Florida, it's just the right size to have wonderful doctors and wonderful care, but just small enough that most of our doctors are willing to go to another level with their patients and provide us that one-on-one care that we need. And so that's the first thing in our level of support that we want to share with you is create those relationships with those people who can help you, especially on some of the most stressful, worst days of your life when you're short of supply, or your toe is all of a sudden infected, or your mouth is aching. So as regarding pharmacists, our pharmacists and our relationship with our pharmacists has really changed our life. Because we have discovered that with all of the things that Lowell needs regarding his diabetes, when I think about the insulin, the pump supplies, the syringes in case of an emergency, the glucometers so we can calibrate, the chem strips that we need for that. When I think about all of those different supplies, it has really helped lighten our load to find out from the pharmacist how we get on auto renewal, how we get 90-day mail order supplies. So when Lowell's insulin comes, it comes in a refrigerated package at our doorstep, 9 vials at a time. That is like manna from heaven when I get that order. I'm like, oh yay, we're down to 2 bottles, I'm starting to worry, but guess what? I called our pharmacist, mail order delivery, 3 months supply. I love it. I get 3 months supply from Tandem, I get 3 months supply for all of those medication. And if I get in a jam or I get in a pickle, or if I forget how to use something properly, that relationship with our pharmacist helps me get back on track. And it's a huge relationship in a diabetic's life, in my opinion, to make sure that you have that opportunity. And the other thing too, of course, is that a good pharmacist will then, they will contact Dr. Gupta or any of our other doctors if his prescriptions start to run low or if they need a refill. Oh, I see you're on your last refill, Nancy, and so I'll go ahead and contact Dr. Gupta for a refill. I mean, that's beautiful too, because we're all busy people, aren't we? And so when a pharmacist is proactive, maybe that's their job, but maybe it's also because we have a relationship. And so I encourage you to form that relationship, particularly with your pharmacist, and ask those questions. Ask Medtronic, can I get my supplies on auto order? Can I get my supplies increased? One time, years ago, Lowell was down to one of his last sensors, and we were out. And we'll talk a little bit more about how to be prepared with product, but I was so worried about that, and I was on the phone, and I said, I'll do anything, I'll even pay cash. And she said, oh, okay, well, why don't I overnight it to you? I had no idea I was allowed to pay cash if it were an emergency. I really didn't know that as a partner of a diabetic. And so sure enough, the next day we had the product. Sure, it was a little expensive on that one moment in time, but would I rather have that one-time expense and not have Lowell be stressed out? Of course. And so that was an answer to some prayers for that day. And so our medical management system is important to us. And these are the kinds of things that we do. So first and foremost, we have a list of all of his medications. We have it on the inside of the kitchen cabinet, right above where I have all of his pills organized and all of his diabetic supplies. It's right beside the refrigerator because the refrigerator has his insulin in it. We have a list of all of his medications on the back of his healthcare card. So if we get to the doctor and they want to see have any of your medications changed, like, I don't know, I don't remember, pull out the card, right? And so it has everything that he takes and what milligrams, is that how you say it? What dosage, what the dosage is. Make sure, where is Mallory? Mallory in the back. Yay, Mallory, our friend. I said to her when she changed her systems recently, I said, if you ever need any supplies, just call us. Because that's the other thing that happens, right, with a diabetic. You're like, oh my gosh, I'm down to my last applicator. Oh my gosh, it's time to change my applicator, and I'm out of applicators. And so we said, Mallory, if you ever need anything, call us. We'll call you if we ever need anything. Years ago, we had that same word, Dr. Brueggemann, when you talked about, am I saying your last name correct? Your presentation was outstanding. But one of the things you said was how many people stigmatize other people for different activities, right? Well, I can remember years ago going to Lowell's brother's house at midnight and calling in advance and saying, we're out of insulin. Can you put one in your mailbox and we'll be by to pick it up. And so we would go by, and of course everybody thought a drug deal was going down. I'm sure, the Lohmans pull up to a mailbox, pull something out of it, I know they're all talking about us in this town. And the same thing happened, we were at a convention in Tampa, and one of us were out of something, remember that? And it's 2 a.m, thank goodness Mary and Victor were with us. We don't like them at all, but we always have them travel with us. I get we love them. But it's just so wonderful that Lowell and his brother happen to be type 1 diabetics together. And remember that? 2 a.m, we're meeting in our hotel room. And I'm sure if anybody noticed through the people that the Lohmans were getting together at 2 a.m, they'd say, what is going on? But that's why. And so that's another. The other thing is, this is Lowell's. This is not mine. This is a gold lame bag, right? But guess how easy it is to find in my pocketbook, right? You can really find it. You know what's in here? Right? I mean, this is his magic little supply of low sugar reaction medicine. They're called Reese cups. And so that's another thing that in terms of medical supplies, I consider this a medical supply. His sugar level goes low, he needs this. And so, of course, Sheila, the last time we were in her office, reminded me too the value of having a glucagon syringe or the nasal spray, which I have now, which is pretty darn cool that they came out with that, I think. And then if you travel, make sure that you always have that travel bag ready to go. Maybe not with the insulin, because you keep that refrigerated, but the value of having a travel bag ready to go, we always have syringes in that. Just in case of emergency, if something went wrong with his pump, we've got syringes. We always have alcohol swabs in there. Just in case you forget to cut this, we always have an extra charger for his pump. And when he used to have the type of pump that used batteries, we always had fresh batteries in there. So that was kind of our car stuff, right? Of things that we knew we needed. And I think I mentioned that up there. Don't we mention our car stock? Yeah. You might not have ever been in a restaurant business before, but in the restaurant business, you have par stocks. They always have a certain amount of flour, a certain amount of sugar, a certain amount of fresh eggs. They have a par stock of ingredients because they never want to run out. So they do their inventory and they reorder when they're down to a few. They don't reorder when they're out. And so, especially if you change insulin products, we got caught off guard with this ourselves. We did not have an accurate setup in our storage area for his different insulin supplies, and we didn't realize, I don't know how, but I didn't realize that the transmitter and the applicator have 2 different life expectancies. I thought the whole thing came in as one, and every 10 days you change that, and so we threw the transmitter out. Right? So guess who got a cell phone call, right? Guess who got a text, right, on Labor Day weekend? How? You know, because we were all of a sudden in this real pickle, and naturally it's a Saturday of a holiday, a 3-day holiday weekend, right? And so have a par stock of your supplies. Don't wait till you run out, make sure that you have that par stock. You always have a few. Like right now I have 2 transmitters, right? They last for 90 days, but I know I have 2 more because I know I need to be prepared with that par stock.
I'm just going to give a few practical tips because Nancy's really giving the bulk of it. But let me say, after what she just commented on, that I think every endocrinologist, Dr. Kapati and myself included, will happily overwrite how many insulin vitals you need per month or how many supplies you need just to give you an extra stock. We are very happy to do that. We feel no shame in bending the rules on that whatsoever. We want you to have extra. But continuing on, a lot of patients don't take their medications properly. So as a patient partner, having that written list is so helpful. Please have a written list of what medication, what dose, what frequency. It can be written or it can be stored on your cell phone, but please have that list. That's probably one of the most important things you can do as a patient partner. And a lot of people with diabetes are not well controlled. So if you want to be a helpful patient partner, my best advice to you is please don't nag. That's not helpful. If you want to encourage somebody to change behavior, try to catch them being good. Try to praise what's going right so that you can empower them. In order for people to make a change, they need to feel empowered. And very rarely when we tell people what they're doing wrong, does it empower them. So catch them being good, talk good about them in front of others when you catch them doing something right to empower change.
Okay, we're going to talk real quickly about your feet, your eyes, and your teeth. Thank you. Yes. So regarding Old's feet, aren't they cute? He has very cute feet. One of the things that has been really important for us is to have annual podiatry exams. But one of the things that I did discover is that I guess it goes without saying, for all human beings, we need to clip our toenails. But that's so important as a diabetic. And if they're kind of thick and hard or difficult to do, I know that probably is TMI, but if it is, then just set up your quarterly appointments. Podiatrists don't mind at all making sure that they check your feet, check your circulation, and trim your toenails. It's just like my dog Snowball, right? I take him to get his nails trimmed, now I take Will to get his nails trimmed. Yeah. So we all got our nails trimmed together in our family. So, it is important to go to your podiatrist for us, it's at least once a year. Now it's every 3 months we go. A couple of the other things that have been real important for us to focus on are good shoes. I mean, there was a shoe provider downstairs that's really good, but having good, comfortable, well-fitting shoes and very loose, comfortable, lightweight socks have been really important for Logan's feet. And the other thing is, in this day and age where everyone likes porcelain tile and LVT and not so much carpet, it's just really important if you're a diabetic to give yourselves a break and have those rug runners, because it is tough on your feet to walk on marble or porcelain tile or LVP all the time.
Right, so just emphasizing a few points. As we all know, diabetes is the #1 cause of non-traumatic lower extremity amputations, and in general, the earlier we intervene, the better. So my next practical tip is, if you see fungal infection in the foot, please advise your patient that you are taking care of to get it treated early. The reason why people get amputations is because infection has spread from the toenails, like thickened fungal toenails, or from the skin. So when you see dry, flaky feet, that's not just dry, flaky feet. That could be what we commonly call athlete's foot. And if you treat those things early, you are preventing the spread, because what happens is the infection spreads from either the nail or the skin into the soft tissues and then into the bone. And when it gets into the bone, we call it osteomyelitis. Osteomyelitis is very difficult to treat. We'll try using prolonged courses of antibiotics, but if we cannot treat the infection, our next step is to amputate the affected bone in order to prevent that infection from becoming a systemic life-threatening infection. So next tip is please treat fungal infections early. No Epsom salt soaks whatsoever for patients with diabetes. That's a big no-no. And we discovered when we were preparing for today's presentation, I just want to let all of you know that anybody who's on Medicare is entitled to one free pair of shoes if you have diabetes every year, which I guess I neglected to ever tell Lowell and Nancy. So please make sure that you know that as well. And Dr. Eric Salzberg was the one who was here today. He's been a wonderful provider of diabetic shoes.
Yeah, that's really cool that you get a free pair of shoes. Thank you for that. Yes, we're excited. So one of the next things that we want to talk about is eye care. So of course that's a common side effect of diabetes is eye vision. And so one of the things that we recommend as diabetic partners is to make sure that we're sort of helping each other understand when our eyesight might be going bad, you know, when it becomes poor, when we start to have poor vision. And that really, I think, holds true for everyone, but it certainly holds true for Lowell and me, that we have been paying attention to whether or not he's squinting more, or that he has blurry vision, or any of those signs that could endanger us in terms of driving, or just, you know, endangering him and having his eyes not checked properly, and then something going wrong that could have been prevented earlier. So those are the things that we watch for. And Lowell has been very proactive with his own health, by the way. I mean, he is a model diabetic. I mean, you're 76 years old, you get a type 1 diabetic this coming February, it'll be 57 years, T1D. And he really is a model for people to know that diabetes doesn't have to limit you at all. And so I think we give Lowell a round of applause for that. And so the other thing too, and there was a woman earlier today who mentioned to me that she knew exactly how to order her groceries, exactly how to use Uber, and she was an older adult, and I was so proud of her for that. And that's very important, that as we start to lose our vision or start to be visually impaired, and we may or may not be able to drive the rest of our lives, which applies to everyone, right? That you become empowered by finding resources to help yourself. And one of those is Uber, right? Uber Eats delivers food. Uber takes you places if you need to go places. Instacart will deliver groceries for you. And I think there's another one, isn't there? Shift or something like that, right? That will deliver groceries. I'm waiting for one of you to start a company called Uber Errands, where I can just have you come to my door, give you a list of 5 things I need you to go do, and then go do them. That's really what I'm waiting for, is Uber Errands. I don't want to go in the car, I just want to send them on their way. Go to the post office, go to the bank, go to the, you know. Because a lot of times I say my whole life is just one big errand. You know, just one big errand. Yes.
Okay, so this is a graph just showing that retinopathy is a common problem, but your A1C at the time of diagnosis certainly influences your risk of getting retinopathy. So if your A1C is lower at the time of diagnosis, your risk of getting retinopathy is less, and if your A1C is higher at the time of diagnosis, then again your risk of getting retinopathy is higher, and with time, the longer you have diabetes, the higher your risk. Having said that, I do want to make it clear that retinopathy, like so many other things in life, is totally not fair. There are some patients who have really not well-controlled diabetes who never get retinopathy, and there are some patients who have decently controlled diabetes, maybe mildly uncontrolled, who get severe proliferative diabetic retinopathy, requiring laser, requiring injections, and causing vision loss. So it's not fair, but it is what it is. Getting annual dilated eye exams is absolutely key. And my tip for when it comes to retinopathy is, if you are the partner of somebody who is a reproductive age woman who is thinking of getting pregnant, please get the eye exam done early before the woman gets pregnant. Pregnancy is a risk factor for retinopathy. Second trimester tends to be the worst. So if we can get a woman's eye disease stable before she becomes pregnant, it makes a world of difference in terms of her preserving vision. And I don't know if Leo or anybody else is here today, but I just wanted to say thank you again to Help a Diabetic Child, who I've now realized is a resource that I can use to help my pregnant women with type 1 diabetes have supplies during pregnancy and really improve the health of them and their baby. So thank you so much.
Okay, so your teeth matter, right? And one of the things that Lola and I do is believe it or not, we do everything together, really. And we even brush our teeth together. I mean, that's just a good reminder to brush our teeth before we go to bed. We wake up at different times a lot of times. I think I wake up a lot earlier a lot of times, right, Lowell? But I'm a lot of times out on the road before Snowball and Lowell really get their day going. And I always say that I'm so proud of Lowell because he gets so much sleep. I mean, that's so good for all of us to get a lot of sleep. It helps with weight loss, it helps with our stress levels, it helps us emotionally, mentally, physically. But we brush our teeth together every night, and we remind each other that we're supposed to sing happy birthday to ourselves silently, right? But we're supposed to brush our teeth a long time. So we try to find ways to make taking care of ourselves together fun. And flossing's not the most fun for anybody, right? But we know it's really a good idea to keep ourselves healthy. And isn't that interesting that the studies have shown that there's longevity of life is equated with how often you floss? I mean, that's enough to get me to floss right there, right? To be guaranteed a long life. Sheila.
We do know that dental issues are more common in patients with diabetes, so we definitely see more cavities, we see more inflammatory diseases, we see more candidiasis, that's also known as oral thrush. We also see more neurosensory disorders. If any of you have heard of burning mouth syndrome, we see that more commonly in patients with diabetes, and periodontal disease for sure. So the tip here is that having a tooth abscess or periodontitis certainly raises blood sugars. Any inflammatory condition in the mouth will affect your blood sugars. So at the same time, treating those things substantially improves blood sugars. You can improve your hemoglobin A1C by almost 0.5% just by treating periodontitis.
What you eat matters, right? We have talked a lot today about nutrition in different sessions. And it's so important to give that some premeditated thought, so to speak, just eat intentionally. So one of the things, of course, and someone else mentioned this earlier today, that they make sure that they go to the grocery store with an understanding of what they know they should buy and what they shouldn't buy. Another thing that Lowell and I concentrate on is what are the things that are good for him to snack on, good for me to snack on, but good for a diabetic to snack on, make sure we have plenty of those kinds of foods. The reality is, Lowell and I both have to go to a fast food place every once in a while too. We're like everybody else, where you just run out of time and you're really hungry and you just need something to eat. And so we have made it our practice to make sure that we know what places serve turkey. I mean, for us, that's our go-to. It's the leanest protein you can eat. And so if we're going to eat meat, and it's really the only meat we eat, occasionally I have a little chicken, but it's really the only meat that we would order intentionally unless we were out to dinner in a group where the choices might be limited. So we know that Chicken Salad Chick has a turkey sandwich. We know Arby's has a turkey sandwich. So that's what we'll Google, Chicken Salad Chick near me, or Arby's near me, because we know we can order turkey on that menu. So it's important to kind of be prepared in terms of finding what you can eat on the run, because it's going to happen. And the other thing too that we also try to remind ourselves, of course, is that everything in moderation, just like our mothers told us, right? Everything in moderation. And so we drink moderately, and Lowell drinks very, very little. And I know that he's healthier than I am, because I like my glass of wine or two. And he's smart not to drink wine because it is full of sugar, some more than others, of course. But the other thing too is that no restaurant ever gets upset with us. Where's Lacey? She saw me come in last night, right, to Stonewoods with diet ginger ale, right? No caffeine, no sugar. And so if we're going to have something to drink, we make sure that we bring it in for Lowell, because he doesn't prefer, obviously, he won't drink any cold drink that has sugar in it, but also he and I both prefer to avoid that caffeine. And so I think it really matters to sort of take stock in what you're eating and be as prepared as you can be. And I try to help him by ensuring that we always have snacks in our home that are healthy for his diabetes. Yeah. And then that matters. So 2 years ago at this conference in 2019, I remember someone saying in the audience, well, how do I know how many carbs are in an apple? And I remember sitting there thinking, okay, first of all, we need to let everybody know that there's some really great free apps on a phone. Like we use Calorie King, right? We just can't remember how many apps are how many carbs are in a type of food. You can get how many carbs are in every type of fast food of every restaurant as well. So you don't have to guess how many carbs are in a milkshake and your sugar's low. You can say, oh, only, I know your sugar's low, but maybe just only take half of that milkshake, right? Because you're trying to create a solution to a problem that you need right now, but you just don't want to overdo it. Another example I always use is an apple, because so many people think an apple has 15 to 20 carbs. Well, not the kind of apples we buy. We buy those really big old delicious Honeycrisps, right? And those have 35 carbs in them. So carbs matter, carbs need to be counted, but every food has a different carb count. And that has really helped Lowell very carefully control his sugar levels, because we paid attention to what's what in terms of the number of carbs in different foods. And then we keep a list of all of his favorite foods and what those carbs are. Because it's hard to remember, right? So if he says, yeah, my sugar's a little low, or I'm gonna have a turkey sandwich with a slice of apple, and I'm gonna eat the rest of the apple as my side course to that turkey sandwich. Well, we know then that that's 40 carbs. And we've got that down now because it's what we have every single day for lunch. But at first we were like, was that 40 carbs or 45? Or was it 50 or 40? And now we just open the kitchen cabinet and there's his favorite foods and how many carbs are in them.
So I felt Nancy nailed this topic. I don't have a lot to add here. Just model healthy eating. Again, if we all ate the way that we tell patients with diabetes the way that they should eat, the world would be a much healthier place. The main tip for this is plan your meals. People who plan their meals tend to make much better nutritional choices than people who don't plan their meals. And finally, I think it's always important to emphasize that it is okay to celebrate, and thank you for what you said in the last presentation. It is totally okay to have birthday cake on your birthday. It is totally okay for everybody to have dessert on Thanksgiving night. The main thing is, the issue is when we make those treats our daily habit, when it becomes part of our daily process to have those treats. That's maybe not the best idea. For your daily routine, make healthy choices. Choose things that nourish your body, choose antioxidants that'll help you fight disease, but by all means, celebrate life.
And so we influence our lives together positively, and that's a real key ingredient to any couple's life, but also for the partner of a diabetic. I know that we can positively influence each other to do things that we know are healthy. And so we influence each other to exercise, swim, dance, walk our dog, turn off our TV. We actually, not that it has to do with diabetes, but we really encourage each other to read a lot instead of watch TV. And we take the stairs. And that's really an interesting study that we read years ago that said that one of the reasons why people lead a long life when they went to study longevity was that people lived in 2-story homes and they took the stairs all the time. And so if you're somewhere like here today and you have that opportunity to take the stairs instead of the elevator, take the stairs. If you have an opportunity to walk up a set of stairs in a office building, then take that opportunity instead of take the elevator. And go outside together. Again, you might say, well, what does that have to do with diabetes? But getting a little sunlight, of course, in moderation, right? Because we all know that the damage to our skin from sun. But being out in nature can really lessen your stress level. And so we encourage each other to go outside. We'll eat dinner out on our dock. We have a little dock, and we eat dinner out on the dock a lot because it's just so serene and peaceful and tranquil, and there are no phones, and it's a kind of a short digital detox moment in our lives. And we encourage each other to get a good night's sleep. Will is so good at that. And I joke around all the time that the reason he's lived so long and is so healthy and been a diabetic for nearly 57 years, type 1 diabetic, is because he's horizontal so much of the time. he gets 8 or 9 hours of sleep every single night. And that's just so wonderfully healthy for him. So I'm so happy he can do that. There's our little snowball at the Orma Memorial Art Museum and Gardens. She likes to take walks in nature too.
Okay, so exercise, of course we all know that's important for physical health. We know that it improves insulin sensitivity. We know that it protects against fracture. But really, the main reason why I push people to do physical activity is for its mental health benefits. We have shown over and over and over again that people who exercise have less mental health burden compared to people who don't. And that's what these graphs are showing. So in the orange is the people who do not exercise, and in the blue are the people who exercise up top. It can see that the mental health burden, which is the y-axis, is much lower in the people who exercise. And the graph below that one shows that in people who have an underlying diagnosis of depression, the same thing holds true. The more you exercise, the less the mental health burden. And there's a reason for that. When we feel stressed, when we feel overwhelmed, we can explain that from an endocrinology perspective. When you are feeling that feeling, it is because certain hormones have gone up, namely cortisol, norepinephrine, those fight or flight hormones. And when you exercise, it literally brings those hormone levels down. So although exercise will not change what's happening around you, it will make you more able to handle whatever is happening.
Positivity is the key. So I have been on many occasions with Lowell where all of a sudden we have to stop everything. Like just this morning, we said, okay, do we have enough insulin to last for today so we can get home and change his pump? Because we know we had 45 units left, right? And you were 100% charged, so we were okay, but we won't be okay if you all want us to go out and party with you after this. We're gonna have to say no, sorry. We have to go home and change our pump. But the reality is there are so many times where, you know, what John Lennon said, he said, life happens while you're making other plans, right? Well, life happens when you're a diabetic. You have to put everything else on hold and take care of your situation. And so there have been many times where I've said to Lowell, I am so sorry that you have to deal with this. And you know what his answer is? That's okay, Nancy, I can handle it. And that's his answer. I mean, he's so wonderfully positive, and I really think that's the same. Is that nice, Leo? Thank you, yeah. And so there are just a couple of things that I think are the key to our positivity and his positivity, so I wanted to share those with you. Not only is it important to find ways to lessen your stress, there's a friend of ours who's building a house on an empty lot, and while the house was torn down, before he started building his house, it became like, you know, the place where people went to net. Remember that term? People used to go to the park and kiss. But it was the perfect place to watch the sunset. And I just remember thinking, gosh, people are parking there. Well, probably if there's some degree of romance that was going on. But a lot of people were probably just saying, I'm just going to stop and watch the sunset. And good for them, right? Stop and watch that sun. We have those glorious sunsets here, right, in Daytona Beach, because we have that vista, that view over the water. And we have glorious sunrises right over the ocean. So take a minute to reflect on life. The CEO of Campbell Soup Company said that he starts his morning, every morning, reflecting on 5 things. So I thought, well, that's really interesting, isn't that? He said, I reflect on 5 things intentionally every morning. My family, my friends, my community, my faith, my company. Those are the 5 things he deliberately thinks about every single morning. And so take some time to reflect on what's important in life, and then be grateful for what you have and find those opportunities to create gratitude rituals. You know, and it takes going to bed every night and saying, I'm going to name 3 things I'm really grateful for today. You know, that kind of a ritual creates that gratitude in you, that intentional gratitude for what's good in your life. And remind each other, of course, not to sweat the small stuff. We all do that, right? I didn't read the book, Don't Sweat the Small Stuff. I still sometimes sweat the small stuff. But so we're all human, but try not to sweat the small stuff. Choose things that help others. If in fact you're feeling down in the dumps, all you have to do is help someone else, and that will make you feel a lot better about yourself. It's just interesting that the more we help others, the more we feel better about ourselves. And we had a funeral director, his name was Peter Maloney. He had a funeral homes in Long Island, New York. I can kind of imitate him. Let me try. You know, Nancy, my son wasn't too happy. He said, you know, he was not looking very happy. And I said, you know what? We're going to do something like that. We're gonna go open up the door for an old lady. You're gonna open the door. And it's gonna feel good. And so here's a road making out. Go open the door. So he's in the food store parking lot. He sends his son in, and he opens this door for this little old lady. He walks back to the car and he goes, I've got you. And it was just such a sweet story, right? Because he probably didn't think about how important it is to do other things for others and that you'll feel better yourself if you do it. But he was teaching his son such an important lesson in life. And I've never forgotten that because he thought it was just I don't think he really knew how important that lesson was for his son. And then just remember for Lowell and me as a partner to a wonderful husband and also a type 1 diabetic, we have talked a lot about the secret to a good relationship. Excuse me. And I think that there's 3 things, right, Lowell, that it comes down to. appreciating each other. Like, wow, that was really nice the way you handled that situation with the plumber. You know, thank you for doing that with the landscape, or whatever those are, those relationships or those things that we do for each other that make our life, you know, move forward. And they can be as mundane as, right, as taking out the trash, right? But guess what? It's trash night tonight, and I guarantee you I'm going to take the trash out, and he's going to thank me for it. I mean, that's how our relationship works. He's always so grateful. And we compliment each other all the time, and we also lift each other up. I mean, we lift each other up all the time. We encourage each other to continue to do things. And then Alan Wolcott, who has written a lot of books on, he started the Center for Loss and Life Transition. So he's written a lot of books about grief and mourning, and because of course I'm a licensed funeral director, I study a lot of initiatives to help people with their healing process. And one of the things that he said is when words are not enough, you have ceremony, right? And so that's why we have weddings, baptisms, bar mitzvahs, you know. So like Sheila said, celebrate those birthdays and eat a bite or two of cake and make sure that you celebrate those special moments in life.
Okay, I thought Nancy's last slide was so nice that I just gave you one secret formula that I like to think about myself. So stress is something we really don't want any of you to have too much. Stress will raise those hormone levels. When we raise those hormone levels, we raise our blood sugars. But we think stress is a equation. And so for those of you who haven't had a kid in public elementary school or elementary school in a while, I'm just going to re-explain what a fraction is all about. So there's going to be a top number there called the numerator. Anything that raises the numerator will raise the product, which in this case is stress. And there's going to be a bottom number, which is called the denominator, and anything which raises the denominator should reduce the product, so reduce stress. So what's in our numerator is pressure. Pressure is things that are beyond your control. Things like standing on a stage, giving a talk with the always eloquent Nancy Lohman, that's pressure. Having somebody in your family be ill, or losing a job, or just general pressures, those are things that are beyond your control. But what is within your control is your resilience, and that's what our last two slides were all about, is building up your resilience. That is within your control. So that's my next tip for now, is up your resilience. You have no control over the pressures that are going to come, but you have a lot of control over the resilience that you build up, and that's going to reduce your overall stress.
Okay, and so lastly, I just want to go over the checklists that have really helped us in life. Because you just can't remember everything, and you just can't be on task all the time, so you just have to have those little cheat sheets in your life. And so a few of the things we keep right at hand inside our cabinet is our list of doctors and the doctor numbers. That's for an emergency, right? Because we know them and they're in my phone, but it's just a good idea in case you have a family member or friend that needs to help you in the case of an emergency. We keep a notebook, a binder of all of our, for both of us, for all of our medical records, and in the front of that is a checklist. Because sometimes, hasn't it happened to you that a month has gone by and you said, did I get my flu shot? I can't remember, right? I mean, there are times where you have to kind of think to yourself. So we have a checklist. And, you know, God forbid colonoscopy, we don't forget, right? I mean, that is something I just don't even want to remember, right? So I have to write it down and go, please tell me, Lord, that 5 years has to come up. Please tell me it's not 5 years. So we keep a list of all of that. But like I mentioned, we keep a list of our favorite foods and the portions and the carbs in them. And we have a checklist of diabetic management. We actually gave that to Dr. McCarty, and she had at the University of Florida made that into a really neat checklist that included a lot of what we gave today. So that has been very helpful. Next slide. This is an example of these beautiful checklists we have. Aren't those impressive? Yeah, next slide. This is the real thing. So these are the real things. So these are our kitchen cabinets, right? And our kitchen cabinet, that's breakfast, lunch, dinner, almost every day of our lives in the top left. Below that are Lowell's medicines, right, in the dosages, right? Not very pretty. The next one, let's see, is Lowell's food that he likes and he can eat, okay? And some of them are a little bit of a stretch. You know, you see turkey dog on there, you're going, really? But you know, like, you know, we're not perfect. We're not perfect. And so we have this list of things. And then because Lowell's very concerned as a type 1 diabetic about his kidneys, he also lists the kinds of things he should and shouldn't eat that help protect his kidneys so he'll never have to go on dialysis. And that's been a whole nother world, you know, because now all of a sudden he doesn't eat bananas, doesn't eat cantaloupe, doesn't eat tomatoes. And those were all things that for years we ate. But then we realized from reading that those are things that are not too great for your kidneys. And so that's been very interesting. But those are, that's good, here's the real example, whatever.
Okay, I think Nancy alluded to this one earlier, so I'll go quickly through this slide. The biggest thing you can do is always, always have a backup plan. Have extra everything. Extra insulin, extra pen needles, extra syringes, extra glucometers sitting around your house. Have extra everything. And then always have a plan for a hypoglycemic event. So it can be the glucose tablets, it can be candy. But now we have so many great glucagon products. We've got the Vaccine nasal spray, which goes up the nose. We have Gvoke hypopens, which function like an EpiPen that you just press up against the skin. We have Gvoke pre-filled syringe that you can self-administer to raise your sugars, but have something. And then finally, if you are a pump patient, please have a backup plan because pumps are machines and machines can break down. So have a short-term backup plan. How will you use short-acting insulin if your pump is coming within 12 to 24 hours? And have a long-term plan. How much long-acting insulin and how much short-acting insulin will you use if your pump breaks down? Okay, so I'm just going to summarize my side of the practical tips, which is, step out. Can you still hear me? Well, I'll just shout it out because I don't think I can read the slides over here. But always have a written down list of your medications. Don't nag, please. Catch people being good and praise their efforts. Treat fungal infections early. If you're even thinking, if your partner's even thinking about getting pregnant, please encourage them to get an eye exam. Treating dental disease will lower blood sugars. Plan the meals, plan your celebrations, and by the way, for Thanksgiving, just take a walk after you've had those desserts, and it will bring your blood sugars down. Up your resilience. I think that's just a life lesson for all of us. Have a backup plan always. And share your knowledge with others. When we share with others, the person who benefits most is the one who's doing the sharing. So please share your knowledge with others. And at this point, I'm going to list some resources that we have put together. We wanted to include the poison control resource because, in case you don't know this, if you're ever with somebody who has a low blood sugar, you absolutely can call poison control and they will stay on the line with you the whole time until that person's blood sugar has come back up into the normal range, and they will guide you through that process. And with that, I'm going to turn the microphone over to Nancy, but before I do, I just really, from the bottom of my heart, want to say a sincere thank you to all of you for coming today. It is just such a pleasure to see how our community comes together. And to the Lohmans, I mean, one of the biggest blessings of my life to have met the two of you. I say it over and over, but I learned so much from them, not just, just about life. It's been a lot of conversations over the years, and according to Lowell's calculations, I started taking good care of him when I was around 4. but it's been a long time, and it's an honor, it's a pleasure, and I think the person who benefits most is me. So thank you all for coming today.